welcome back. I'm Mabel Jong, and this is the World Healthcare Congress coverage here, 2017, from Washington, D.C. Thank you so much for joining us. In the studio right now, we have Dr. Kayur Patel, who is President and Chief Medical Officer of Wellness for Life Medical. Dr. Patel, thank you so much for your time today.
Well, thank you for inviting us. Thank you.
Well, we've just been talking a little bit about your model, which actually is a very old one, started by Henry Ford, or he was one of the people who had this in his own industry. How does it work today, direct primary care?
Well, what we're doing is essentially going to the larger employers who are self-funded, because today in the payers market, they're the ones who are interested in changing healthcare. They are responsible for their entire bill for their employees. So we would actually have a clinic for their employees and their dependents. So for example, if there's 1,000 employee company owner, we would give benefits to those 1,000 and their dependents. So we act as a primary care model where we have access to care, and we have a tremendous amount of patient engagement with the physician, because we allocate a lot of time.
And does the clinics, they're essentially clinics, would you say, or do they sit right in the headquarters of a particular industry?
Yes and no. They're called on-site or off-site. Most of the clinics are off-site because a lot of the consumers of the clinic are dependents and not necessarily employees. So keep it geographically best located would be to say, let's see where the residents live, the dependents live. So most of the time they're off-site.
Okay. There's already a shortage of primary care physicians nationwide. What are the benefits of a physician joining a group like yours versus a big HMO or ACO?
Yeah. You know, that's an interesting question. There's a shortage of physicians across the country, and it's going to continue over the next years and maybe even more than that. However, we're able to attract in our model the best in class, and here's why. We've created an environment for the clinicians to work in, because today's market, we remove the barriers being billing, coding, insurance verification, insurance approval before you do a test, and most of the primary care practice today work on a production model. So more you see, more you do, more you take home. But we've eliminated those barriers, so it allows these clinicians to really work in an environment where you can actually take care of patients, and that's what they went to medical school in for, is to take care of patients and spend that quality time with the patient, and not be a factory, not be a production, not just have 3 minutes with the patient, and have the 20-30 minutes with the patient so you can actually make a change.
Right.
So really, despite the shortages, we're able to attract the best in class.
Okay. Dr. Patel, you started your business at a very chaotic time in the industry, and actually you are growing at an even more vague time in the sector's history. What keeps you going in this area? What do you see on the horizon that does guarantee some sort of future for this kind of model?
You know, if you look at the healthcare, where it's headed, essentially I break this down to 3 modules: the patient, the providers, meaning the clinicians in the hospitals, and the payers. Of the 3 components of healthcare today, the only group that's interested in making any change is the payers. And because the patients will just follow what they're given, the healthcare industry as a whole, meaning the providers, are really not interested in making a change, or making it affordable, or making it accessible. So it's really the payers. And there's no other way to really save the healthcare spend other than kind of containing, eliminating the fat. What we're able to do is eliminate a lot of barriers and fat, so we can actually deliver a better quality product, spend more time with the patient, and overall save costs for the company.
And in your view, I mean, we've talked a lot over the years about how much American healthcare does cost stakeholders. What is the biggest problem you see in terms of costs? What needs to be eliminated immediately in your view?
You know, when we look at the cost for healthcare, it's overutilization, misuse, and abuse. So when we say overutilization, it's like getting CAT scans, MRIs that are maybe not necessarily really indicated. We have other alternatives, but in a fast-pacing environment, when I have 3 minutes with a patient, I'm like, it's easy for me to get a CAT scan than to sit down and do a detailed exam and really talk to the patient. And when the patient and doctor interactions are not there, they're always afraid I may get sued, so let me just get a CAT scan. So you've really never established a good relationship. So now you're sort of doing other things which are easy because you're sort of strapped with time.
Right, okay. And some of the encouraging things that you see, I mean, aside from costs, that you see that this is the time for your model?
Well, I feel like for clinicians, this would be a dream job because this is a place where they can enter and not worry about a production, not worry about volume, because we're converting volume to value and value to outcomes. So instead of worrying about how many patients did I see today, our clinicians are looking at and saying, how many patients in the last week have I cut their medications from 5 meds to 4 or to 3? And how do you do that? Patient engagement. You know, convincing the patient this is the right thing to do, not another pill to fix your cholesterol, but eating right to fix your cholesterol. You know, it's not a mystery anymore what to do and how to do it. But really, the problem in today's primary care world is execution. Because really, there's no way to execute if you don't have time with the patient. So what we're doing is allowing our clinicians to spend time with the patient to really deliver that model, but deliver the care that they really deserve.
Dr. Patel, thank you so much for your time today.
You're welcome. Thank you for allowing us to talk. Thank you.
Thank you. And I've just been speaking with Dr. Kayur Patel, who is President and Chief Medical Officer of Wellness for Life Medical. Thanks for joining us. There are many more interviews to come, so stay tuned. I'm Mabel Jong.